Now, Utah Representative Jason Chaffetz, he's a member of the House Oversight and Government Reform Committee, which will hold a hearing on the government's response to Ebola later this morning. Congressman, nice to see you.
Good morning.
Okay, so what are the big concerns that you will be raising at the hearing today?
Well, one of them is about our military. We have nearly 4,000 troops that are in the infected area. How are we treating them? What sort of exposure problems do they have? How are we going to bring them home? What is their condition? These are great heroes, but you got a lot of families across this country concerned about those people. We also have the Inspector General who's coming in and says that the federal government is woefully underprepared. When you look at the personal protective equipment, there has not been good management of this. Many of the things that have expiration dates are expired. He's a very scathing report, having read his testimony and what he's going to say later this morning. It's not a pretty picture from the preparedness from the federal government.
But the CDC tries to assuage our fear by saying that they now have put out new guidelines. Their new guidelines are more protective. They now conform more with the Doctors Without Borders guidelines. So does that help your fear factor?
No, I mean, this person who is now in isolation in New York City, bless his heart, you gotta love a guy who goes into an infected area, wants to help people, but he was with Doctors Without Borders, which is a wonderful organization, but comes back here and has the disease. And I think we really need to look at travel bans and quarantines. I don't buy into the idea of a self-quarantine. That's obviously not working. And we're sending a lot of mixed signals, and I think that's part of the discussion this morning as well.
Jay Gupta, our medical correspondent, has reported that he just got information within the past hour of government officials saying that they are considering a mandatory quarantine for people returning from those West African countries. Do you know about that?
I don't know that the administration is doing that, but there are those of us for a couple of weeks now that have been saying you should probably put some sort of travel ban in place. And if you've had direct contact with an Ebola patient, somebody who has the disease, we're going to have to put you in quarantine. It's good for you. It's good for your friends and your loved one. It's good for the United States of America. I just don't think you can have somebody with direct contact with an Ebola patient and then allow them to go bowling in New York City. That's just not going to work.
And by the way, this mandatory quarantine would be for healthcare workers. That's what we're talking about. Will the new Ebola czar, Ron Klain, be at the hearing today for you to ask questions of?
No, we invited him. Congressman Issa, our chairman of our Oversight Committee, invited him to come. He's been on the job, I know, since only Wednesday. But really, when you come to Congress, you're there to answer questions from the people of the United States of America. And he refused to come. I think that gets him off on the wrong foot. I think the country would like to hear from him and what he's doing. We have a lot of questions for him, but he has refused to attend.
You have been public with saying that you wish that a Surgeon General were in charge of this effort. You've been calling for a Surgeon General. Of course, there are many Democrats who say that Republicans in the Senate have blocked the president's nominee for a Surgeon General, that we could have had one a year ago, but Republicans have been an impediment. What's your response?
Well, I haven't gotten in the middle of that Senate fight. I'm here in the House. There is the office of the Surgeon General. There is an acting Surgeon General. They have access to thousands of people across the country that are medical professionals and have expertise. I don't understand why we wouldn't leverage them. Our criticism of Mr. Klain, I'm sure he's a nice gentleman, but he has no medical experience. And so they're talking now at the White House, well, we want somebody who's an implementer, not a doctor. I want a doctor, somebody who understands the science here, to try to coordinate all the different agencies, local and federal. And then when we do have that person, now that we have the czar that the president picked, he won't come answer questions from Congress, from Democrats and Republicans. I don't understand that. But I think the Surgeon General's office needs to be integrally involved. There are other agencies and people within Health and Human Services that also need to be intimately involved in this, if not leading this.
Well, of course, I mean, that's what the administration says that Ron Klain is tasked with, which is coordinating all of these different siloed agencies, the NIH, the WHO, the CDC, and getting them all to sort of be on the same page, that he's has managerial expertise. What do you say to that?
We have questions for him about how he's doing this. We're going to have the Inspector General, who took a very objective view over a long period of time and came in, and they will say that the federal government is woefully underprepared. They don't have the personal protective equipment. I got serious questions about how are our Customs and Border Patrol agents? They're wonderful, hard-working people. How are they supposed to assess these travelers that are coming into the United States of America and try to guess whether or not that do they have Ebola? Were they in that infected area? What should we do with them? You have doctors that can't make these types of calls who are actually in the infected area. How are you going to have a Customs and Border Patrol agent dealing with this? There's a lot of questions for this person.
All right, Congressman, we will be watching your hearing today closely. Thanks so much for taking time for us this morning.
Thank you.
All right, let's